I'm Sohail Abbas. I'm a GP in Bradford and the clinical director of Bradford CCG, and also the chair of the Health Inequalities Network. Can I have the slide, please? Yeah, this is the infographic that the Health Inequalities Network created. We call it West Yorkers. That's what you can see behind Sarah. And these 2.7 million people that we serve in our West Yorkshire and Harrogate Health and Care Partnership, they are described in this slide as 100 people. Next slide, please. And out of these 100 people, 20 out of 100 are from Black, Asian, or minority ethnic communities, which is 1 in 5, and that is what this review is about. And that tells us the importance of the work we are carrying out in our health and care partnership. Next slide, please. And as we have heard many times today, and we know that this pandemic, this COVID-19 pandemic, has shown a light on health inequalities in West Yorkshire. And these are the 20% people who are concentrated in most deprived areas in West Yorkshire, who are overly represented in the high-risk population, in the high-risk occupations, and they are at extreme risk of morbidity and mortality with this pandemic. Next slide, please. So a little bit about the Health Inequalities Network. Health Inequalities Network is one of 4 networks working with the Improving Population Health Program. The membership is multi-organizational. We have true representation of health and care sector with local authorities, with general practice, primary care networks, with the CCG, with acute trust, community trust, public health, voluntary and community sector organization, and universities. And the network, there's a lot that is going on in the health inequalities sector at the moment and within the network. But if we bundle it together, these are the 3 things that the Health Inequalities Network is doing and is aiming to do in future. The first thing is to support the system leadership and capability. The second aim is to increase the capacity across the system to tackle these really systemic health inequalities. And the third thing is to make sure that how we improve the use of intelligence, data, and insight to understand and address these inequalities in a better way. And we are working across the whole system. It's the whole population health approach. We're working at the system level, which is our ICS. We will be working at the place level. And as you know, in our ICS, we have 6 places. We'll be working at the neighborhood levels, the primary care networks, the partnerships, and right down to the individual, because at the end, it's the experience of that individual, which is who is receiving the health and care from us. Next slide, please. There are just a few examples of the work that the Health Inequalities Network and our partnership has been doing for quite some time, and that describes that there is so much work already going on, and this review is really bringing it all together. So these are just a few examples. So for example, we had the grant funding. Recently, the Health Inequalities grant fundings were awarded to the voluntary and community sector across our partnership. And 8 out of 14 successful applications were around interventions to improve health outcomes for the Black, Asian, and minority ethnic communities. And you can see some of those voluntary care sector organizations on the screen. The Health Inequalities Prevention Pathway Framework, that is something that, again, the Health Inequalities Network has developed. And this is a resource to really support the people to understand. So we have done, you can see the importance of this work in Sarah's slide, when we're talking about for example, inequalities in mental health. So if the ambition is to reduce inequalities in mental health in a particular ethnic group, then obviously that is our population segment. And we will be looking across the whole prevention sector. We will be looking at the primary prevention. What are we going to do about the wider determinants that are making people prone to ill mental health? How can we diagnose and detect those people better? And then how can we treat them better? So this prevention pathway framework is going to work across the whole spectrum. And the thing is, one other or program in Bradford that we are is called Reducing Inequalities in City program. And that's an £8 million mega project, recurrently funded system-wide program to improve the health and reduce inequalities across the lifespan of people who are living in the most deprived area of central Bradford, what was former Bradford City CCG. And about 70-75% of those people living in the central Bradford are from Black, Asian and minority ethnic communities. So the Health Inequalities Network, how will you support the findings of the review? We are going to support the development of the action plan. We will bring together the intelligence and insight to continue to improve our understanding of inequalities, especially related to ethnicity. We are focusing the work of the network on population groups identified in the review, and we are working to develop and launch a West Yorkshire and Harrogate Health Inequalities Academy. And that is the first of its kind in the whole of England. And we are really looking forward. We're working with the partners in the partnership and with the university partners to launch this Health Inequalities Academy. And this academy, the ambition is that this will not only become the resource to go to, not just for our places and our region, but it will be a national example of good practice, that how the West Yorkshire is tackling health inequalities and sharing good practice. And we are going to work with the health inequalities executive leads to implement the interventions and monitor outcomes. And we have full commitment to continue to work with our voluntary and community sector to embed community-led approaches to reduce health inequalities, because at the end, it is the community resilience that is going to work. And I'm just going to end on this quotation, this quote from a 11th century Sufi saint of Persia, the Shams of Tabriz, the spiritual mentor of Rumi, that it's pointless trying to know where the way leads. Think only about your first step and the rest will come. And that's what we are doing in West Yorkshire and Harrogate in our partnership. This BAME review is the first step. We have taken it with the right intention. We have taken it in the right direction. And we trust, we are confident that working together, the rest will just come. Thank you very much.